Hi everyone, I'm Ross Millar. I work at the Health Services Management Centre at the University of Birmingham in the UK. What I'd like to do now is briefly present an overview of a paper published in Sociology of Health and Illness. The paper is From Mao to McDonaldization, Assessing the Rationalisation of Healthcare in China. So the backdrop to this paper is very much entering into China's healthcare, which is very much characterized as a highly marketized environment and has historically, certainly since the reforming opening up era, been characterized by putting profit before patients. The use of financial incentives that have driven activity and driven all sorts of organizational professional behaviors. The 2009 reforms are an attempt to challenge those norms and traditions. A very much government-led agenda that's looking to increase access, regulation, and just overall sort of control over healthcare provision. This review is looking to bring together the evidence from health services research, but also sociological contributions to better understand the extent to which this government-led agenda has achieved greater forms of rational organisation control over healthcare provision. And to do that, the paper has drawn on the perspective of George Ritson, McDonaldization, and the extent to which China's healthcare reforms have achieved greater efficiency, calculability, predictability, and control over its healthcare. And what it finds is the review essentially does identify elements of McDonaldization in these 2009 reforms, but it also identifies notable gaps in sort of getting that formal rationalization over services. And very much the story of China is the power and domination of public hospitals and the sort of profit maximization activities associated with these institutions. So in that sense, the review, McDonaldization brings us something, to brings us into sort of those dynamics in greater detail. But there's clearly limits to this perspective that the review's drawing on in terms of how far it can articulate local cultures, local meanings. And as a result, the review essentially looks to sort of as a critique McDonaldization as a way of understanding healthcare reform, and in doing that looks to bring in alternative perspectives for how can we understand healthcare in China, and very much calls for a need to complement the burgeoning health services research that's being undertaken in China with ethnographic research and sociological perspectives that can bring us different ways of understanding what is happening and why.